This is a story about the most rapidly progressive human tumor, Burkitt Lymphoma. Burkitt lymphoma was first described by the Irish surgeon Dennis Carson Burkitt in 1958 in Ugandan children. Since then, numerous breakthroughs, including the discovery of the Epstein-Barr virus (EBV) and its links to the disease, have been made.
Burkitt lymphoma is a type of non-Hodgkin lymphoma, or NHL. NHL is a cancer of the lymphatic system. It develops when the body makes abnormal B lymphocytes. These lymphocytes are a type of white blood cell that normally help to fight infections. When you have a lymphoma, the abnormal lymphocytes build up in lymph nodes or other body organs. Burkitt lymphoma grows quickly and the treatment starts soon after diagnosis.
The lymphatic system is an important part of our immune system. It has tubes that branch through all parts of the body. These tubes are called lymph vessels or lymphatic vessels, and they carry a colorless liquid called lymph. This liquid will circulate around the body tissue. It contains a high number of white blood cells, or we call lymphocytes, which fight infection.
When you have lymphoma, some of your white blood cells don't work properly. They start to divide constantly but don't develop fully, so they can't fight infection as normal white blood cells do.
There are two main types in lymphocytes, which are B cells and T cells. They both help us fight infection, but in slightly different ways. Burkitt lymphoma affects the B cells, and so it's called B cells lymphoma. How common is it? Burkitt lymphoma accounts for only 1% of adult lymphoma, but up to 30% of childhood non-Hodgkin lymphoma. The average age of children diagnosed with Burkitt lymphoma is between 5 to 10 years of age, while adults are usually diagnosed between age of 30 and 50 years.
Burkitt lymphoma is the most common type NHL in children in the UK. Adults can be diagnosed, but is more unusual. Burkitt lymphoma is more common in males than females. Outside Africa, Burkitt lymphoma is rare. In US, about 1,200 people are diagnosed each year, and about 59% of patients are over age 40.
Burkitt lymphoma is especially likely to develop in people infected with HIV, the virus that causes AIDS. Among all countries worldwide, those sub-Saharan Africa have the highest rate of HIV. The countries with the highest rate of HIV include Swaziland, Lesotho, and Botswana.
So next, the types of Burkitt lymphoma. There are three main types of Burkitt lymphoma. These types refer to the cause of the disease and where they are more common in the world.
The first one is sporadic Burkitt lymphoma. This is the most common type of Burkitt lymphoma and it occurs worldwide. Sporadic Burkitt lymphoma is linked to a virus called the Epstein-Barr virus (EBV). This is the virus that causes granular fever or mononucleosis. People who have mononucleosis might have a higher risk of developing NHL, but it is important to remember EBV is very common. There are many people with EBV who never develop lymphoma. It is usually start in the bowel and form a bulky tumor mass in the abdomen, often with massive involvement of the liver, spleen, and bone marrow. It tends to affect lower abdomen, which is at small intestine ends and large intestine begins.
The second one is immunodeficiency-related to Burkitt lymphoma. This type of Burkitt lymphoma can develop in people who associated with human immunodeficiency virus HIV infection. Second, had an organ transplant who taking immunosuppressive drugs.
The third one is endemic Burkitt lymphoma. This type of Burkitt lymphoma is the most common in children in Africa. Some research suggests a link with malaria and EBV. It can cause extremely painful and disfiguring swelling of the jaw, eyes and face, and also abdomen. It attacks quickly and can be fatal within a weeks or if not treated promptly and appropriately.
A tumor can double in size within 18 hours. It tends to affect facial bones and jaws, small intestine, kidneys, ovaries, and breast may also be involved.
For pathogenesis, Burkitt lymphoma are a tumor occurring in endemic, sporadic and age-associated form. In the classic example of human malignancy, whose pathogenesis involve a specific cellular genetic change, namely as a chromosomal translocation, deregulating expression of the CMYC oncogene, complemented in many cases by the action of an oncogenic virus, the Epstein-Barr virus EBV.
September is Leukemia and Lymphoma Awareness Month. The lime green ribbon representing lymphoma awareness.
Approximately every 4 minutes, someone in the United States is diagnosed with leukemia, lymphoma, or another type of cancer that affect the blood cells, bone marrow, or lymphatic system.
So, with this awareness month, we can educate people about the harm of this cancer that affect most of the people. Together we fight lymphoma.